Hello, my name is Lisa Custer. I'm from Beaverton, Oregon. I have been a kidney patient for the last 12 years, and I am currently a home hemo patient. My kidney disease journey came when I was 50 years old. Currently, I'm 61. And I had a crash moment. I had no idea that I had a kidney disease. I am an adopted Native American Indian, and therefore I did not know any of my medical background. I have done all the modalities. I've had the in-center PD as well as the home hemo modality. And I have no desire to get a transplant due to religious reasons of being Native American. And I am thriving on home therapy, and I enjoy it. I live independently. I have always kept my hands in the finance industry, though in Portland my skills are highly sought after in the public and the private sector, and I work on contract. The PLT medication has been absolutely instrumental for me to be able to achieve phosphate goals, to keep them down and keeping me alive and keeping me out of the hospital, especially for a heart attack. Without that, none of the exercise, losing weight, none of it would matter. The absolute glue to my success in living every day is to have the PLTs with my meals and my snacks. If you do not have your medication, if it is not administered properly, it could result in death. It is extremely difficult, but it is extremely doable and manageable. But it requires discipline and focus. As of January, my unit had to get involved with the delay of my PLTs. It was a very difficult time. I had RSV at the time of the change. And what my unit had to do, and it took a month for them to do it, because there was a heavy amount of confusion at the center level, miscommunication on many levels, and I finally got them the first week of February. And with my illness dissipating and with the finally getting the medication I needed, I was finally able to end that illness, which should not have been 90 days. It should have only been 30, and that was because of the peel. That was a direct reflection. That the movement of the current oral only phosphate-lowering therapies into a bundle creates complexity for patients, for medical providers, as these drugs were never designed or intended to be administered concurrently in a dialysis session. The mechanism of action required for delivery of the GI tract is when food is present. Phosphate binders are purposely meant to be taken during the course of the day, not the dialysis session. And particularly since eating during dialysis is discouraged and it's been outlawed since COVID. This is a bipartisan issue. And all of you need to do the humane thing, the right thing, the intended thing for this type of medication. And that's keeping the phosphate-lowering treatments in Medicare Part D and not in the ESRD bundle. It cannot be. We are all not the same.